My name is David Gray, and on behalf of Justin King and our Workforce and Family Program, I'd like to thank you for joining us today for this event, The Trends in the Well-Being of Younger Children. Today is one in a series of events that we're hosting on the well-being of children, and we are most grateful to the Foundation for Child Development for making them possible. The Foundation for Child Development has long been a leader in promoting the well-being of children, and they have commissioned the report that is being released at the event today, Trends in Infancy, Early Childhood, and Middle Childhood Well-Being, 1994 to 2006. This report presents a wide-ranging picture of how children in the first decade of life are faring in the United States, and is the first to track and compare child well-being across the three primary stages of development, early childhood, middle childhood, and adolescence, using the Child Well-Being Index. It is an important report and has already received a fair amount of attention, front page of the Washington Post and the ABC Nightly News, because of the uniqueness of the report and the importance of the issue. And we're grateful to NBC and C-SPAN for covering this event. We are pleased to partner with Dr. Ken Land of Duke University, who helps develop the Child Well-Being Index and has authored today's results. In a few moments, Dr. Land will explain the report, and copies of it are available on the table outside. Then we have a distinguished panel of experts who will respond to Ken's presentation, and there's a very strong group of you who've come here today, and so we want to reserve time for what we think will be a robust question and answer period. We're grateful that you've come. First, allow me to introduce Fasaha Trailer, the Senior Program Officer at the Foundation for Child Development, to give some opening remarks. Fasaha?
Thanks, David. Thanks very much for your introduction. Oh, you want me to go up there? Yeah, okay. Will do, will do. Thanks so much for the introduction, and we're just so pleased that the New America Foundation Work and Families Program has been really so enthusiastic about sponsoring this work and releasing the reports that have come out of this project. And we're also grateful that so many of you want to discuss these issues because we think that they're really very important. Every year, we at the Foundation for Child Development, we're just more and more convinced that measuring and monitoring how children are doing over time is fundamentally important to our nation's well-being. By fundamental, I mean that it's basic to planning the future, it's essential for correcting problems, and it's critical to identifying trends for parents, government, and our social institutions to address. Since its first public release in 2004, the CWI, as we've come to call it, has deepened and sharpened our knowledge of what childhood is like in the United States. And today's special focus report is no exception. There are just 3 points that I want to make before introducing Ken, who will present the report. First, the CWI is about all kids, not just a few kids, or just disadvantaged kids, or just kids with special issues, problems, or even advantages. This doesn't mean that there aren't groups of children who have challenges that should be addressed or that we don't have work to do. But it is important to remember that these are population-based analyses that provide a broad context for understanding how any particular group of kids is doing over time. Second, the CWI provides a systematic way to tell whether things are getting better or worse for American kids. We all know that childhood has changed, and the CWI tells us how much and in what areas. Finally, the CWI analyses lead to the conclusion that policies, parents, and institutions really do matter. We are not helpless in the face of these big, what we used to call intractable problems. And this claim is not based on wild-eyed idealism, although some might say that about me. The CWI provides evidence for us to make this claim based on decades of data. And it shows that when we have rolled up our sleeves and worked on particular issues, Our combined efforts have made a difference that shows up in the data decades later. We are deeply, deeply grateful to Ken Lamb, John Franklin Crowell, Professor of Sociology and Demography at Duke, his colleagues Vicki Lamb from North Carolina Central, and Hui Zhang, also at Duke, for their work on these analysis and this report. Their dedication and attention to the thousands of details involved in this CWI makes this effort possible. So thank you very much, Ken.
Thank you. Thank you very much, Fasaha. Let me preface this presentation today by acknowledging my indebtedness to four groups. First and most obviously, the Foundation for Child Development. But secondly, I want to acknowledge that what we're engaging in today and in the CWI project is a form of social reporting, social indicators development and social reporting. And I want to acknowledge the indebtedness to the social indicators movement and their leaders from the 1960s and 70s who 4 decades ago noted that we had good economic indicators for what's happening in American society, but very poor social indicators. And in particular, that movement was led by such people as Ray Bauer at MIT, Eleanor Sheldon at the Russell Sage Foundation, and later the Social Science Research Council. Albert Bitterman, just down the road here on M Street at the old Bureau of Social Science Research. Mansur Olson, an economist at the University of Maryland, who very much would have appreciated the kind of efforts we engage in here on the CWI reporting. The third group of people on which we build are the pioneers in the subjective well-being studies, which started by and large at the University of Michigan Survey Research Center with the efforts of Angus Campbell, Phil Converse, Frank Andrews, and Stephen Withy in the 1970s. The publication of their works in 1976 and later and then the subsequent 3 decades of work that many social scientists have replicated and extended their work. We now know a lot more about subjective well-being, not only of adults but of children and of adolescents than we did 3 decades ago. And the CWI builds upon that body of research literature. The fourth group I want to acknowledge is what we engage in the CWI simply would not be possible without the people who do the real work in putting together the data series. And in particular, I'm referencing the federal statisticians by and large, many of them who work with the Federal Interagency Forum on Child and Family Statistics. These are statisticians, demographers, social scientists, and they are the folks who get out there and collect the data and do an excellent job to make it as sound as possible and put together data series on which we can build. And as a card-carrying statistician, I fully appreciate the work they engage in. Also, as part of that group, I would acknowledge the work of Brett Brown and folks at Child Trends who often build and extend the work done by the federal statisticians. So with that as a preface, I'll get on with the presentation. But I did want to acknowledge our indebtedness to those folks. So if this thing will work, I want to indicate again that this is a project at Duke University, and over here on my left, Dr. Vicki Lamb and Wei Zhang, who work with me on the project. They're here to answer the tough questions if we get any of those later on. So what I want to indicate to begin with here is that, just to review for a moment, we developed the CWI, and it's based on 28 indicator time series, most of which date back to the mid-1970s. And this gives us a good historical view on trends in child well-being over 3 to 4 decades now. We reported this last year in our annual update last year, and that's sort of the record over these decades. And what the CWI does is it's a composite index that, again, builds upon what the subjective well-being literature tells us about things that determine individuals' overall satisfaction with life, including those of children, and well-being, quality of life, if you will, and we compose those indicators correspondingly. And we were, I think, what we echoed here when we first began our studies is this long slide, recession, if you will, in child and youth well-being in the U.S. in the late 80s into the early 90s, and then the recovery that we saw in the mid to late 90s, and what we indicated last year, essentially the stagnation that we've seen in the years since 2002. Now, the thing about this, the overall CWI, is because the time series date back to the mid-1970s, many of them focus on adolescence, the adolescent age group, and what we were concerned with was that we said, well, maybe we need to focus a little more on the early childhood, the first decade of life, in particular infancy, early childhood ages 0 to 5, and the middle childhood ages 6 to 11. And then we could make corresponding comparisons with the corresponding adolescent age group 12 to 17 and try to see what's happening to each of these distinct age groups. And in particular, we again were aware of the rapid improvements in the 90s for the adolescent teenagers, and this raises the question, however, were most of the gains of the 90s concentrated in the adolescent age group, and did in fact in the first decade of life, did children at younger ages experience those improvements as well? So there are 4 particular questions we addressed in this particular study. The first of these is, do our composite indices of infancy, early childhood, and middle childhood, do they show well-being improvements since the mid-1990s, or have the improvements been concentrated mainly among adolescents? Secondly, in the CWI, as I'll indicate in a moment, we identify several well-being domains of well-being based upon the subjective well-being studies. And some of these domains of well-being can go in one direction, others can go in another direction. And so we wanted to ask how the trends vary among the 6 domains for which we can get data for the first decade of life. So the question here is, have some of the domains improved more than others? The third question we address, are there any particular indicators of well-being that have done substantially better over that 12-year period from 1994 to 2006 than others? And in particular, are there any indicators for which the improvements are notable? Fourth, the question is, correspondingly, are there any indicators that are trending negatively since the mid-1990s? Any indicators that have deteriorated? Now, of course, all of this depends upon how much data are available, and we would be the first to admit that there are many aspects of well-being of children for which we simply don't have good indicators, but we've done the best we can in this report to put together the data series, which you'll see in a moment, and compose them into our composite well-being indices. And this is a chart that addresses that first question, changes in overall composite well-being across the 12-year period. Again, you can interpret the composites as kind of a like a consumer price index, with the 1994 in this case being the base year, and measuring percentage changes since then. And we've got the 3 age groups indicated here, the adolescent age group, middle childhood, infancy, early childhood. And you can see the very substantial gains made in the late 1990s, and then the impact of the 2002-2003 recession, and then some slight increases in the period 2004-2006. But that's basically the story on our composites across the 12-year period. And what we see with these composites is that the average percentage changes were not concentrated just in the adolescent age group, but also were shared among the indicators we have available, at least, for the infancy, early childhood, and middle childhood years as well. The second question is about domains, and the overall composite CWI distinguishes 7 domains of well-being. Again, these have been identified based upon the subjective well-being studies, and there are things like family economic well-being, social relationships, health, safety, educational attainments, community connectedness, participation in institutions, and emotional well-being. For the present study, for the two youngest age groups, we simply could not identify any data series that really fit into that emotional well-being domain, so we worked with the 6 other domains in our comparisons in the report today. The specific indicators that we've got available, again, we raked through the data sources as best we could, and these are the ones that we came up with. They're detailed in the report. I'm not going to spend, I don't have time to go through this table in great detail, but there are 3 pages of indicators here, and we compose those into our domains of well-being. Let me indicate that the indicators that are composed into the domain-specific indices are outcome indicators, are surrogates for outcome indicators, and we do not include in the domain-specific indices nor in the overall composite any of the risk factors or some of the indicators of access to and use of health care, for example, which are more like input indicators rather than output indicators. But in any case, what you see here is for the infancy, early childhood years, there is some diversity of trends in change since 1994. Some of them trend up more considerably than others. Some of them just get above the 100 baseline from 1994. This one in particular shows a slight decline in the mid-1990s. But by and large, what we see here is some slight improvements or changes on the improving side over this 12-year period. For the middle childhood years, we see that there is again some diversity among the domains of well-being, health being pulled down by one of the areas of concern we identified later, namely increases in prevalence of overweight children at the very upper end, and one that goes way up here, and that remarkably has to do with the improvements in child safety. The third question we address is, can we identify any specific indicators in our database for which the news is basically good? And I want to highlight a few of these here today. Am I taking too much time? Doing okay? One of these is has to do with infant, early childhood, and middle childhood mortality rates, and the percentage changes are for this 12-year demographers might consider these percentage changes something that would happen over 3 or 4 decades. But actually, over this 12-year period, you see a quite substantial drop in mortality rates for the age group 1 to 4, and even some drop in 5 to 9. Infant mortality is at a relatively low level, historically low level for the U.S., although internationally not so good. But nonetheless, the story here is this very substantial decline in child mortality at these 2 age groups over the 12-year period. And again, these percentage changes are quite remarkable in the experience of demographers. Here's another good news trend. This is the percentage of children under 6 years old with elevated blood levels using the 10 micrograms per deciliter criterion. And you see that the earliest year here in this particular series, 1997, you're in the 7.5% range, and by 2006 down near 1%. Now, as we noted in the report, epidemiologists would say that any presence of lead in blood of children is potentially harmful, and there are certainly concerns that we're still too high with respect to the 5 to 10 micrograms per deciliter level. But at least for these extreme levels of blood lead poisoning, the trend over this time period is quite substantial, and good news. Here's a risk factor that we highlighted in the report. This is an indicator of the percent of total births to mothers who smoke during pregnancy.
And you see again that it's declining from about 14.5% or so in 1994 to the 9 to 10% range in the most recent years. And again, this is good news. And you can take this indicator as just an indicator of that particular behavior, or you can take it as an indicator of underlying changes in the attention that pregnant mothers are paying to the health of their babies. And if you take it as the latter, it's indicative of more general underlying trends of improvement that you would like to see. So to continue on, good news trends here. These are attachments to institutions, in particular preschool, kindergarten. We know that cognitive development is very important in these years, and these are trends that are favorable to the well-being of children in subsequent years. We did a report, I believe, a year ago last summer, which focused just on trends in education and test scores, and we noted that those improvements and expansion of full-day kindergarten could be possibly a leading indicator for what we see here, which is the improvement in test scores, NAEP test scores, especially for the years from 1999 to 2004. And if you consider that those expansions in kindergarten program occurred a few years earlier when these kids were younger, lo and behold, it shows up in the 9-year-old test scores a few years later. So possibly a leading indicator there, lead-lag indicator relationship. Another good news trend, and this is remarkable, this is what the kids tell us in the surveys. This is the percentage of 6th grade students who fear attack or harm in school or going to and from school. And it's down despite 9/11 and despite all of the scary news that we see on YouTube and the internet and as well as television day after day. Now, what's behind this? We can have an interesting discussion of that. I'm not sure anyone really knows. Maybe the parents themselves are taking the initiative to try to ensure that their kids feel safer in school or going to and from school. Another good news trend is that the percent ages 6 to 11 participating in extracurricular activities. The lessons part here is a good news trend. Internationally, we're in a highly competitive, globalized economy, and the performance of our kids with respect to test scores and cognitive abilities and so forth are very important, and so time spent on lessons is important as well. We identified only 2 indicators that seem to show negative trends of concern. One of these is the percent of low birth weight babies, which has consequences for cognitive and neurobiological development. That trend is up and possibly a negative area of concern. The second is, of course, one that we've identified before in our reports and very much in the media, which is the increasing prevalence of very much overweight children, obesity, if you will. Conclusions. Jason is giving me the hook, so I'm going to get off of here in just a moment. But our composite indicators, again, do show some overall improvements in this 12-year period. There's variability in the domains of well-being and the family economic well-being domain in particular tracks over time expansions and contractions in the national economy. Among good news indicators, we identified several. We identified a couple of indicators that are going in directions that are of concern. A looming overall concern here is we stop with 2006, and we all know in this room that 2007, 2008 have brought new news, in particular financial and housing crises in the economy, increasing job layoffs, rising inflation and food and housing and all sorts of things. And what are the implications of these recent events for child and youth well-being? I can give you my conjecture based on the charts that I showed you earlier, I think we will see during 2007, 2008, when the data are available, which will not be for 2 or 3 years, when the data are available, we will be able to show that there was a decline in child and youth well-being on the order of 1 to 2 percentage points in our overall composite indices. And if the recession turns into something even more serious, then of course that decline could be even more severe. Thank you.
Thank you very much, Ken, for that presentation. I know you'll have some questions for Ken on the report later on, but we're going to have our respondents come up now and have them give their presentations, and then we'll have a chance for a question and answer for Ken or for any of our presenters in a few minutes. We have a strong group of experts here with us today with a variety of experiences in a number of fields who can comment both on the report and provide some analysis and thought based on their own experiences on what can provide the greatest difference in the lives of our children. We're grateful to all of them for taking the time to be with us today. Why don't you all come up here and we'll shuffle here and get ready to go. We've got, as our guests are coming forward, we've got more extensive biographies available at the door. But first we'll hear from Sarah Mead, who is the Senior Research Fellow in the Education and Policy Program and in our Workforce and Family Program here at New America. Then Valerie Kaufman, who is the coordinator of the Early Learning Branch of the Maryland State Department of Education. Bruce Leslie, who is the president of First Focus, a bipartisan organization dedicated to making children a top policy priority. And Lauren Ratner, who is director of Family and Community Health at the Association of State and Territorial Health Officials. We're very grateful that all of you could join us today, and we begin with Sarah.
Good morning. Ken has talked about the rationale for dividing up the Child Wellbeing Index to look separately at the indicators for different age groups of children, young children, middle childhood, adolescence. And I think that's particularly important in the case of education, because when we look at the data on educational achievement and educational experiences, we do see really significant differences in the experiences and outcomes of different age groups of children. Specifically, when we look at the National Assessment of Educational Progress, the nation's report card of how children are doing in academic achievement, we see elementary school students' achievement over the past decade or so increasing, improving in both reading and math. We see middle school students' achievement improving in math while stagnating in reading. And when we get to high school students, we see achievement in both reading and math either stagnating or declining, depending on what particular time frame you're looking at. And these are significant differences in what's happening with different age groups of children in education, and looking at these indicators separately can help us to understand what's going on and think a little bit about our education reforms and how they've been impacting different age groups of students. A second key point I think is important to make in terms of what the Child Wellbeing Index tells us about children and education is that while the Child Wellbeing Index since 2002 has largely stagnated overall in terms of children's well-being, when we look at a lot of the educational indicators, we actually see some really valuable increases for young children over that same time period in terms of more children enrolled in full-day kindergarten and in terms of 9-year-old achievement in particular. I think there's two particular things we need to look at here. First is the whole issue of accountability and reform and the No Child Left Behind Act. States have really used this as an opportunity to focus on early education. We see, increased focus on scientifically based reading instruction, at the state level, things with class size, full-day kindergarten, where states are seeing this as an important step to build a strong foundation for children so that they can achieve later in their educational experiences. States are investing more in these things as well. And we also, over the course of the 1990s through 2000, have seen an increase in public attention and awareness about the importance of young children's development. Things like I Am Your Child, 0 to 3, that really have educated parents about the importance of early learning for their children. I want to look specifically at a couple of positive indicators in further detail here. The first is full-day kindergarten, because I think this is really striking, and it's something that I think a lot of people are not aware of, that the number of children, the percentage of children who are enrolled in full-day as opposed to half-day kindergartens has increased substantially from less than half in 1995 to about 2/3 today. That's a tremendous increase, and it's something that people haven't noticed, particularly when we look at all the attention that's focused on pre-K and the national pre-K movement on all the attention there, governor's efforts to expand pre-K, but we've actually seen a bigger increase in full-day kindergarten enrollment than we have in pre-K enrollment. And largely this expansion of full-day kindergarten is a very good thing. Research shows that it has benefits for children, particularly low-income and at-risk children. It gives children more instructional time so teachers can cover more content and help them get a stronger foundation. And it's equally important that it meets the needs of working families. Half-day programs don't satisfy the needs for a lot of parents these days. And we've seen specific states making full-day kindergarten a priority. A couple examples: Arizona, Governor Janet Napolitano has really pushed for full-day kindergarten there, going from basically no program in 2003 to 86,000 children enrolled today. Similarly, Pennsylvania in 2004 created an accountability block grant that gives funding to local school districts. More than half of the funding for that program is being used for full-day kindergarten, and the percentage of children in full-day kindergarten has increased about 50% since then. Preschool is another indicator that we see. We definitely see an increase in preschool enrollment from 1994 through 2006, but one of the things that I found really striking looking at the Child Wellbeing Index report was that we don't see a dramatic increase in pre-K enrollment since 2001, even though we've seen the emergence of this national universal pre-K movement, lots of activity in the states expanding funding for pre-K programs, and the number of children in state-funded programs going up by about 40%, from 700,000 to over 1 million today. Yet we don't really see that reflected in the overall data on the number of kids that are in preschool, the percentage of children. Now, why is that? I think one issue here is we need to ask some questions about the data. Because we don't have a system for early education at the preschool level the same way we do for elementary school, sometimes it can be really hard to get accurate information about what people actually mean when they say kids are in preschool, where children actually are, because it's such a fragmented system. So we need to ask some questions there about where are these kids actually, and what has parents' understanding and the public's understanding of that changed over time. I think a second piece is that we need to realize that state pre-K is still a fairly small percentage of children, despite all the attention to it. Only 22% of 4-year-olds are enrolled in state pre-K programs, and just 3% of 3-year-olds. So this is a tiny segment, and while the percentage of 4-year-olds enrolled in state pre-K has increased, the percentage of 3-year-olds has basically stayed stagnant. Since we're looking at this indicator for 3- and 4-year-olds, that really minimizes the extent to which we can see growth. Private investment, child care spending is still a huge part of the game, probably the majority player in preschool enrollment here. And I think we need to look at the potential that stagnation in child care funding, declines in the number of children covered by programs like CCDBG, could be contributing to families switching from preschool to lower cost family home care, kinship arrangements, and that is working against some of the increases in state pre-K funding to overall mitigate some of that impact from increasing the number of children enrolled in state programs. We also just need more inquiry on this. We need to try to figure out, does this data mean that state pre-K investments aren't getting bang for their buck, or does it mean that something else is going on that's actually harming parents' ability to send their kids to preschool on their own, and we really need more pre-K investment in order to keep a positive trend in terms of expanding children's enrollment in pre-K. Going beyond that, I think achievement at age 9 is really the core indicator here, and you see that's the indicator that Ken uses for educational achievement, because really all the stuff that we're looking at in terms of pre-K, full-day kindergarten, smaller class size, all these investment states are making really lead to that goal of having children at proficient by 3rd grade, by 4th grade, by the time they take these NAEP assessments that we have this long-term national data on. And that's where we see a lot of good news that these investments seem to be paying off. Reading and math scores for 9-year-olds are up. The trends are statistically significant. The report cites increasing preschool participation in the 1990s as a potential increase. I think it's equally important to look at the reforms in education at the K-12 level, in early elementary schools, in the 1990s and since CLB, particularly things like the National Reading Panel, Reading First, class size reduction, that have really focused in heavily on young children. This seems to be working, but the fact that we don't see similarly strong results at the middle and high school level should raise concerns about whether this is generating long-term results. I think there's two responses. One is we need to carry these reforms up into the middle and high school years, where a lot of the reform has lagged behind what we're doing at the elementary school level. But two, we really need to improve the early years and make sure that children are getting a strong base. Even despite the improvement in performance, only about 39% of fourth graders are proficient in math on the NAEP, and only about 33% are proficient in reading. And those children who haven't achieved proficiency in math, the majority of children who haven't achieved proficiency in reading, are really going to be vulnerable to falling behind when they get into middle school and high school. And I think that's a lot of what we're seeing. At the same time, a lot of the reforms that we've done in early elementary education have in some ways been, I don't want to say marginal, but they haven't necessarily gotten to the core. We're doing more, but a lot of the times we're just doing the same things. We need much more fundamental reforms that make schools more efficient by aligning curriculum, by really strengthening academic rigor and making sure what we're doing is scientifically based, so that we know that children are building a solid base and that there's deep roots to what they're learning. Just briefly, I wanted to touch on health indicators. Declines in lead poisoning are obviously beneficial from an education perspective as well. If you know educators who work with children who have that, you know that it has a devastating impact, so that's very good news for education. Finally, the economy. The report mentions the economic downturn, and obviously that will have negative benefits and negative impacts in terms of children's family economic well-being, but I think it's equally important to look at the impacts on education. States have expanded pre-K funding, full-day kindergarten funding, early elementary funding. That could be in jeopardy as states face tight budget circumstances, particularly since such a large percentage of state budgets now is tied up in K-12 education and healthcare, Medicaid. It's increasingly difficult for states to try to protect K-12 education and early education investments. So far, states seem to be holding the line on pre-K, but ultimately there's not a lot left to cut outside those two domains now, so we need to be concerned about that and really look at what role in federal investment can help protect against cuts in those areas going forward. Thank you.
Great. Thank you, Sarah. Now I'd like to ask Valerie Kaufman to come up, please. Justin.
Morning, everyone. I'm happy to be here to represent the Maryland State Department of Education. And I'm going to need that clicker, I suppose. I'm not a fast talker like that. I'll try to make it 10 minutes, but there's no way I'll be able to spit it out that quickly. I was really thinking it would be nice for Dr. Land and I to be able to talk for a little bit, because a lot of the things he talked about this morning I'm going to share with you in this perspective from the state of Maryland. And I don't take ownership for some of this because I'm putting together perspective that is broad between birth to 5, and that basically is our initiative in Maryland. Okay. So the quality of life and well-being for children in Maryland, I personally feel has improved. And as I was listening to Dr. Land and his report and talking about the things that have improved, I'm going to be sharing with you some of these indicators that we are looking at in Maryland. Okay, so I'm starting with, and I kind of blanch when I hear the term expert. I'm not an expert on this issue. This is the Department of Health and Mental Hygiene in Maryland, but our collaborative nature with them, we are sharing lots of ideas and initiatives. So the Babies Born Healthy is one of the initiatives over the last 8 years that has been a part of recommendations from the Governor's Office of Children, Youth, and Families. And so I'm going to be discussing briefly 3 of those areas: Babies Born Healthy, Healthy Children, and Children Entering School Ready to Learn. Okay. So Babies Born Healthy indicators are infant mortality, of which Dr. Land mentioned, low birth weight, births to adolescence. The infant mortality rate has long been considered the most sensitive indicator of the overall health of the population because there's a lot of events that go on in a woman's life that contribute to the loss of that child. Some statistics that were analyzed and looked at by maternal characteristics, and Dr. Lamb mentioned this, to better assess the population and the greatest risk, show that fetal infant death occurs almost 3 times more often among black women than white women. Now, this is Maryland in particular. Okay, the prevalence to, and here if you look at the, I hope I don't push the wrong thing, you said here, the little top thing. If you look, there's been a decline, and then there was a slight incline in the infant mortality rate in the years of 2003 and 4, and then we've seen a decline over the past couple of years. So as you look at these statistics, as Dr. Lamb mentioned, the decline has gone in 1997 from 8.6 for all races to 7.9 in 2006. All right. Babies born healthy, and one thing I want to mention too, when we talk about infant mortality rates, it's been found that infant death, there's 6 infants are born premature. For every infant death, there's 6 infants born premature. And the impact cost for Maryland has been $32 million a year. It's a share of that Medicaid cost. The Maryland Infants Born Healthy program focuses on 4 concepts. Preconception, interconception health, before and after babies are born, prenatal care, neonatal safety, and post-neonatal support. Okay. All right. Maryland has focused on several things to ensure that babies are born healthy. Expansion of Medicaid eligibility, teen pregnancy prevention, Federal Healthy Start Project, that's specifically for Baltimore City, State Commission for Infant Mortality Prevention, the expansion of family planning services, voluntary prenatal standards of care for hospitals, and prenatal outreach programs to provide consultation for high-risk obstetrics. Okay. And in the future, we plan to focus on reproductive health services with high teen birth rates in Maryland, especially among Hispanic adolescents. Support for community programs for education for teenage women and men, and after the birth of the first child, and securing stronger public and private partnerships throughout the state to provide additional reproductive health services for women in need. And also to expand the perinatal collaborative to ensure, there at the bottom, the perinatal collaborative to ensure the continued emphasis of quality obstetrics for women. Okay. The second initiative we looked at was Healthy Kids. Preventive care for children through the Healthy Kids program. And as you can see, there's a number of, oops, go back, a number of agencies that have collaborated on this effort of Healthy Kids Maryland. Okay. The initiative I'm going to talk about for, let's skip through this part, is the Maryland Model for School Readiness. In 1995, the National Goals Panel recommended that states find a way to determine that children were entering school ready to learn. Maryland's goal was to establish a large-scale assessment system to look at outcome indicators, and Dr. Lamb mentioned these outcome indicators, to determine whether children were entering kindergarten programs with the necessary skills for success, and to develop early learning standards that would ensure quality programs for all young children. It began as a pilot program in 1996 using the work sampling system in half of the Maryland school systems. And then MSDE customized the work sampling for 30 indicators, and again, 7 domains were mentioned: personal and social development, language and literacy, mathematical thinking, scientific thinking, social studies, the arts, and physical development and health. In school year 2001-2002, during the first quarter of the kindergarten year, all Maryland children were assessed on the 30 indicators. Assessment information was reported to the state, and the assessment has continued over the last 7 years with impressive results. This year, in the 07-08 school year, we were able to see that kindergarten, starting out in 01 and 02, 49% of the Maryland kindergartners entered school prepared to learn. This year, 68% were rated fully ready to learn. Okay. So these are some of the things we found that has worked in Maryland. High quality standards for children, teachers, and programs. Professional development and training for all early care and education providers. Credentialing program for all child care providers. Community outreach and public engagement campaigns, Countdown to Kindergarten. We have a Universal Preschool Services Committee or task force that's been working over the past 2 years. Collaborative work between the state agencies to improve child well-being, and the responsibility for all early care and education with the Maryland State Department of Education, where I'm located. We had this year, for the first year, full-day kindergarten began in Maryland as a mandate. Also, pre-kindergarten for all income-eligible children was also mandated this year. And as I said, we mentioned the Universal Preschool Task Force working on Universal Pre-K. And we are moving forward slowly, but we're moving forward with that initiative. There's a work group looking at a work plan to develop the what will be a high-cost project for the state of Maryland, but we're hoping that it will be a success. All right.
Thank you very much. Mallory, particularly talking about the expansion of some of the pre-K fits in quite well, what Sarah mentioned in terms of states making that emphasis. Now, Bruce Leslie, the president of First Focus. No, I do.
Great. Well, first of all, I'd like to say thank you to the folks here at New America. I mean, David Gray and Justin King have really been pushing this project and working with the Foundation for Child Development on a great project, and I think that it's very important that these indicators are really spread, and it's also believe all the work at Annie Casey with the Kids Count project. These are all things that really help the child community in terms of looking at where's the progress, where we need to work on, things we need to do, and really kind of dovetailing with investments in kids and how that's impacting their well-being. Let me see. Here we go. What I'd like to talk about is some response to what we saw in the report, but then also kind of what we think in terms of investment. What's going on at the federal level with respect to investment in children? So first of all, I want to talk about perceptions. What are the perceptions that people have about how things are going with kids? Also, the second is to talk about the reality of how things are going on with children. And then third is the importance of investment. And last, what are our opportunities to deal with these indicators and improve the lives of children? So the first thing is, this is an article from the Washington Post. Dana Milbank, who is a very esteemed reporter for the Washington Post, ran an article last September in the middle of the S-chip debate and talked about how lawmakers on both sides know that a piece of legislation that stands a much better chance of passage if it's about kids. Well, those of us in the kid world know, really? Is that true? And so he cited all these bills of, look at all these bills that are introduced in the name of children. So we kind of looked at what's happened to those bills. So we in the kid community, there's a perception we don't believe that that's the reality. And I think that an important thing to note was there was in 2003, there was a whole debate in Congress about Medicare prescription drugs for seniors. It cost $400 billion. There was a debate just a few years later on S-chip. 1/11 of the cost. One passed, one did not. And there was a lot of discussion about why did people vote against the S-chip bill? Well, those were the arguments that people used. Well, these same arguments. I mean, they were far more expensive, far greater levels of crowd out. So all the arguments people used didn't really fly for some of us who had seen both debates. So in terms of the report, I think that it was very important to look at the issue. First of all, the glass is half full, and that there are improvements in child well-being since 1994, and that's a very important thing to note. I think also, as Dr. Land pointed out, that the vast majority of those improvements came before 2001, and so in 2002 was sort of the high water mark. And since then, we've kind of had a flattening out. And so what's going on there? Also, there's sort of the good news and bad news about all this. With respect to child and infant mortality, certainly infant mortality is going down. That's a great thing in our country, but we could be doing much better. And if you look at our data compared to other nations, as Dr. Lamb pointed out, we are behind 25 other countries. Good news is also educational achievement is going up. The bad news is we still rank low in the national reporting on science and math scores. Also, child well-being has improved in the last 10 years, but then you can look at, you do the international comparison, the UNICEF report, and we rank 20 out of 21 countries. And one of the important things about that report is asking people, why is it the United States and Britain, we're the two lowest? What's going on there? And what they say, what the researcher talked about was the lack of investment. And what's been interesting is in Britain, we have this huge campaign going on to reduce the level of child poverty rates in half. And it's having significant changes in the way the British are now beginning to invest in children. I think that one of the things we'd like to see is that sort of campaign happen here, because I think what you're going to start seeing is the trend in Britain is going to be improving, and what's happening here is a very different story, which I'll talk about. We also, and on these things, some of the things that were highlighted on things that are improving, why did those things improve? And we invested in public health campaigns in this country to address lead poisoning. We did it both at the CDC, we also did it at HUD. Smoking during pregnancy, huge campaign about smoking cessation and the importance of prenatal care. And infant mortality did go down for a number of years. We have noticed that if you look at, for example, investments in Healthy Start, I think there's a correlation with investments in Healthy Start reducing infant mortality, but the last few years actually spending the Healthy Start program has declined. So one of the things we're really working on is reauthorization of the Healthy Start program and pushing for increased investments there. So one of the things we looked at is, with respect to investments, we did analysis of the last 5 years of, looked at all the appropriations bills and all the programs, and what we did is try to ascertain what are the child programs in the federal budget. We identified over 180. If people should look at our report, it's on our website at firstfocus.net, and if you have things that we were looking for feedback on those things, but what we tried to do is ascertain what are those programs and how are we doing as a nation. So we looked at all of the non-defense spending at the federal level on children. And what we found was only about 1 in 10 dollars is spent non-defense. So if you add in the defense, it's even far less, is spent on children. So here's the trend line. We were about 11% a few years ago, has dropped now down to 10, which doesn't sound like a big deal, but that's a 10% decline over that period of time. It's also not an issue of there's no money. There's definitely has been some new investments. I would say the last 2 years there's been no money. But over this period of time, of the 5 years, there's actually $231 billion of new money spent on non-defense programs. We want to, if you count the defense, it's way more than that, right? But just non-defense, $231 billion. How much went to kids? 1%. Just 1% of the money went to kids. This number was so shocking to us that we kept looking at it and said, really? Could it be that bad? And yeah, so basically kid funding has been flat. And if you take out Medicaid, there'd be virtually no increase whatsoever. So here's the story on discretionary spending on children. This is inflation-adjusted numbers, and you can see the decline over the period of time. And you can also see it's not just an issue that discretionary spending has been tightened. It's also an issue of that actually kids were, in some ways, really sort of picked on in a manner of speaking. Kid spending actually declined in discretionary, but other discretionary spending went up substantially. On the mandatory side, as I mentioned, Medicaid did go up. So there is a story of, yeah, kids got some increase on the mandatory side, and it's also an important thing to think about with respect to what we should do, because mandatory spending does help children. However, even there, you can see that mandatory spending on kids did not keep pace with other mandatory spending. So in looking just at early childhood programs, what you'll see in our report is we did it by various domains. But just then, even if you try to look at sort of a slice like early childhood, we identified these programs, and it's kind of hard to do because you can't really get data on Medicaid and S-CHIP by age very well. You almost have to go to all the states. So we're doing additional analysis of this. but just with these programs, what happened with early childhood. And what you see is sort of a flat level of spending, but actually if it's inflation adjusted, a decline even there. So there has been an initiative, and there's been a lot of talk about how we need to do things on the early childhood side, but at the federal level there's actually declines. So you can see early childhood spending on the mandatory side, but the discretionary side has been a huge cut, and that's reflected here in some of the programs like Head Start. You know, we've actually seen an effective double-digit decline in Head Start spending over the 5-year period on the Child Care Development Block Grant. So while we're having investment at the state level and a lot of talk, there was a governor's summit in Utah just last week talking about early childhood development and spending and initiatives by the governor there. Well, if we're cutting programs at the federal level, any new investments at the state level is only replacing the lost federal dollars. So the big 4 findings we had in our report is, one, of all the new spending, over the last 5 years, of every dollar, kids got 1 penny of money. Spending on kids declined by 10% over the 5-year period, and that's resulted, only make up 10% of the thing, which has been a 10-year a 10% reduction. And if this trend continues, kids spending will actually drop into single digits next year. And also that it's not just an issue of mandatory, that Medicare, Social Security are on the mandatory side. This is an issue of discretionary side. And you can see on the discretionary side alone, declines for kids, increases in other programs. So we are shortchanging our children, and that girl is not very happy about it. So what is our opportunity here? Our opportunity is that the public is actually very much on our side on this stuff. We did polling with 2 Republican pollsters here, Frank Luntz and Bill McInturf, and what they show is very strong support for various programs, and this is just a small sample. We did it on early childhood, we did it on budget issues, and what you can see is on S-CHIP. We know last year the S-CHIP numbers were highly in support of, the public was very in support of passing this legislation. You can also see that in terms of if you pair kid programs to other programs, very strong support for kid programs against other things, and actually you'll see it's not just bipartisan, it's tripartisan, and Republicans actually have the highest level on that question. So it is not a partisan issue. The other thing that I think what Frank Luntz talks about is, you can do the question in any room and say, are you better off than the past generation? Everybody raises their hand. You ask the next question, which is, do you believe the next generation will be better off? And when he did this poll, he found that a slight majority of people felt the next generation would not be better off. But he now says that when he does this question and asks audiences, it is overwhelming. People do not raise their hand that the next generation will be better off. And I did ask this question in a gathering of about 200 people in Colorado, and 2 people raised their hand. So there's this feeling in the general public that the next generation is very challenged by this. And so we do have an opportunity because you can tap into that. People do believe it, and people do believe we need to do something about this problem. And you can see it. You can see it in advertising. And so this comes from AARP's website. And what they've done here is, they're concerned about issues of Medicare, Social Security, pensions, rightfully so. And who are they using in their ad campaigns? Children. And so they know it. They know that there's a concern about kids in the future. AARP's tapping in it, and we in the kid world, we don't do a very good job of it. You can also see there's a great Environmental Defense Fund commercial, if you haven't seen it, there's an adult staying on the railroad tracks, and there's a train barreling down, and he says, I don't know if it's this big important thing for me, because I probably won't be here when the world when problems start happening with the environment. And he steps off the tracks, and there's a little kid, and that's how the ad ends. And so you see this tapping into this problem with senior groups, environmental groups, and it's because we do have a resonance on our issues, and I think that we stand a chance, and I hope that in this election year that we really work to get the candidates to commit to doing something about this problem. So thank you.
Great. One.
Hi, my name is Lauren Ratner. I'm with the Association of State and Territorial Health Officials. We're the membership organization for state health department directors. put that up while I'm speaking. I was a little bit nervous about, as Justin said, cleaning up at the end of this panel, but I think after Mr. Leslie's presentation, we can only be more positive. It makes mine look a little bit less negative, although I do echo his call that we need to be doing more. So, since I'm in mixed company, I'll go ahead and give you just a little bit of background on the on state health agencies, so that you have an understanding of why I'm here. And I wanted to also go ahead and thank you all for bringing me here to represent the state health agency perspective. Our members oversee the state public health agencies that include programs in environmental health, chronic disease, maternal and child health, emergency preparedness and response, injury prevention, tobacco, and then a wealth of informatics and data surveillance programs. In addition, there's a subset of our members that also have oversight of mental health and substance abuse, as well as Medicaid. Wanted to also establish just a foundation on the state maternal and child health program, so I'm not going to read through these, but as you may or may not know, funding for maternal and child health comes primarily from the Title V Maternal and Child Health Block Grant that's administered out of the Health Resources and Services Administration, Maternal and Child Health Bureau. And it funds a pyramid of services, and this is not in pyramid form, but with the bottom of the pyramid being infrastructure building services, the next level up being population-based services, enabling, and then the tip of the pyramid, meaning the services that Title V funding should be spent least on, is the direct health care services. Title V programs serve 33.1 million women and children, and that's 2.5 million pregnant women, 3.9 million infants, that's less than 1 year of age, and 22.5 million children ages 1 to 22 years, and then 1.4 million children with special health care needs. So with that background, going into the trends of note, in the interest of time, I'm just going to focus on two of these trends. I figured I would take the good with the bad and do one trend that has improved and one trend that has declined or showed disimprovement over the years. So I'm going to be focusing on prenatal smoking and childhood obesity. And what I'd like to do is just to give you a sense of what's happening at the state level, not necessarily describe, tell you what's responsible for these exact changes, but to give you a sense of what the menu of options are at the that are going on at the state health agency. So starting with the good news, prenatal smoking. And what I wanted to present here is the degree to which this issue is a priority with maternal and child health programs. TVIS is the Title V information system. It's the reporting system for state maternal and child health programs. They report on a total of 18 national performance measures, one of which, number 15, is percentage of women who smoke in the last 3 months of pregnancy. There's also 6 national outcome measures, all having to do with infant and child mortality. And then states identify with their every 5-year needs assessment 7 to 10 priority needs that they as a state have identified. Here, prenatal smoking is identified as a state priority need among 9 states, the ones listed here, which means that they have specific measures dedicated to prenatal smoking. So next is just a menu of policy options. These are policies that can be enacted by the state legislatures, and the state health agencies play a critical role in both advocating for policies as well as providing the data to help inform decision making at among the legislators, and it ranges in terms of what can be done policy level wise. What's happening on what's happening with the state. There's a large menu of options that states can use. I'll be going into those on the next slide. I jumped ahead of myself, but what I did want to do is highlight these recommendations from the Community Guide. The Community Guide is a summary of community-level services that have gone through rigorous review and that are being recommended by a task force, either with strong evidence, with sufficient evidence, with insufficient evidence to either recommend or not recommend, and then not recommend. So these are all tobacco-related interventions that the Community Guide has reviewed and can recommend with strong evidence. So I won't go through those, but so that you know what is out there that state health agencies as well as policymakers can choose from. So, and then just to give you a couple of examples of what we know states are actually doing. The overall trend is state health agencies focusing on really trying to engage providers. And here we have examples of a variety of providers: WIC, the Women and Infants and Children Nutrition Program, physicians and mid-level clinical providers, and then family planning clinics, which are just a wonderful point of access for so many women who wouldn't be engaging services otherwise. And then Oregon developing a case management program. So having done that, I'm going to go on to the bad news, obesity. Just a quick overview of what the influences are, and then here again referring to the Title V information system. 25 states have identified obesity as a state priority need. So that is not what they're reporting on out of because they're mandated to, but these are 25 states that have said that obesity is something that they need to focus on and are going to be collecting data on. Here again, state health agency policy options. I won't go through these, but hopefully you're having enough time to read them. But the role of the state health agency is really facilitating the achievement of these. None of them are going to happen, or few of them are going to happen on their own, either because they require other decision makers at the table or because they require funding. And the one thing I wanted to note with obesity prevention is that a lot of the activities are actually happening in the schools, and the partnership between the schools and the state health agency is really important when we're talking about obesity. So, and then also just to focus a little bit more on the role of the legislature. These are also approaches that state legislatures can take. The starred options are ones that were most frequently either enacted or considered during the 2006 legislative sessions. So, and then moving on again to the Community Guide, these are recommendations on physical activity, which, as we know, is one major component. Increasing physical activity is one major component of preventing obesity and overweight. I'll let you read those through for just a minute. And again, just to note, these are only recommendations that come with strong evidence. So, state examples for obesity. We have a few different types here. Tracking BMIs, Arkansas has an active program that's really focusing more on the role of state health agencies in collecting data, monitoring trends, and making recommendations based on those. Safe Routes to Schools, which are actually run out of departments of transportation, but in conjunction with the state health agencies. And then just to be a little bit more to give you a little bit more of a program flavor, Color Me Healthy, which is in both North Carolina and South Carolina, and that's traditional type prevention programs for preschoolers where you have songs, you have newsletters, resources for parents, easy recipes that can be made from home. And Just to note, the Safe Routes to School, there is a coordinator in every single state at present. So, I couldn't stand up here and not point out the issue of disparities. I just plugged in a few statistics here that would help us remember that not all children are either improving or suffering at the same rate, and we really need to make sure that we maintain a focus on achieving equity in health that will level out, get all of the kids on the same page. Challenges that we're facing. This was touched on just a little bit, but the Maternal and Child Health Block Grant, it has seen a decrease in funding most precipitously in the past 2 years, and this is at the same time as there have been, I think there's over a 2 million increase in the number of individuals served by Title V programs in this same time period. This is the Preventive Health and Health Services Block Grant. This is funding that comes out of the CDC to fund most of the state health agencies' chronic disease programs. Also seeing a drop in funding levels, as well as a threat of being zeroed out every single time it's gone through the appropriations process. Also, the workforce, major challenge for public health agencies. We're aging. It's going to become a major problem in a few years, and states are already taking major steps to try to address those now. And then finally, I just wanted to make sure that I mention that state health agencies can't do any of this alone, nor do they. It's very dependent on their partnerships with departments of education, with Medicaid and private insurers, departments of transportation such as Safe Routes to School, environmental agencies. Very important when we're talking about lead poisoning, state legislatures that are making decisions about funding and programs, and then of course the provider groups who are actually delivering services to kids. So with that, thank you very much for having me here, and I'll pass it back.
Great. All right. Thank you to all of our panelists for that stimulating conversation, and now we're going to go towards our question and answer. I'm going to start with questions for our panelists just very briefly. First, on health, to Bruce and to Lauren and to Ken. Obesity is perhaps the greatest issue that comes out of the CWI, and certainly is highlighted in Ken's report. If there's one thing that we can learn from the public health campaigns of the past, or from what states are doing on obesity, what would it be for the federal government to think about in terms of obesity policy? That's for the health folks. And then for Ken, Valerie, and Sarah, I think about the full-day kindergarten for youth, 4, 5, and 6, and what difference that may have made in terms of their test scores when they get to be 9-year-old. I'm wondering, in light of the budget numbers that Bruce talked about at the federal level, it makes me think about state budgets. I think about the state of California, for instance. Do we think in the future that those gains of kindergarten will be lost because of budgets, or do we think the states, despite budget situations, or maybe because of individual state budgets, are going to continue those investments? So first the health question, if someone wants to take it, then the education question, and then we'll turn to the audience.
Well, with respect to the health question, I think that it is important to say that the public health campaigns in the past have been successful. So, as Ken's report showed, was smoking prevalence has declined, and that was all about a public health campaign. And I think that the lesson learned is we need to do that with respect to childhood obesity in a big way. And I know there's Senator Harkins, Senator Bingaman, and others are very into doing so, but there really isn't a major public health campaign that's going on with respect to childhood obesity, as there should be. And I think if we did that, we could start seeing reversals of the trend. I mean, it needs more than just Shaquille O'Neal having a television show talking about it and helping 6 kids. It needs to be a national campaign.
Anyone else want to jump in?
I would agree with that. I'm not sure that we know at this point what type of public information campaign would be most effective, but it's clear that we need to do for obesity as we've done for smoking. We need to address it very seriously and concernedly.
Okay. All right.
And I would just say that we need to keep in mind the policy level and the environmental influences on people's choices around eating and exercising. So there really does need to be action, not just related to public education, but ensuring that there are safe places for people to exercise, places where they can get affordable foods, and I think that's something that needs to happen both at the federal and state levels.
Great. Valerie and Sue, what do we think about the future of full-day kindergarten?
Well, as I attempted to state in my presentation, that over the past 3 years, Maryland really has been moving forward with full-day kindergarten, and this year it was a mandate for all school systems to have full-day kindergarten. And this year also we are going forward with a key, an identifier for each child that will follow them through their school career. And so I'm not sure that we could say yet that we can, have the data that we're seeing this particular school year, 07-08, we could attribute to full-day kindergarten. But I know that for those jurisdictions in Maryland where they have had full-day kindergarten for the past 3 years perhaps, they are seeing increases in the number of children who are being assessed as ready to learn, and also when there's a pre-K, public pre-K or other collaborative child care pre-K programs in that jurisdiction, we're seeing the children are showing increased readiness scores when they enter school. So, and as we look forward, we're looking forward to, with that key identifier for each child, to the 3rd grade Maryland School Assessment then, to see if those children who are doing well or fully ready when they enter kindergarten are then progressing through 3rd grade and into the upper elementary grades.
That's great. As a parent of a child who's getting ready for kindergarten and we try to decide whether to stay in the district or move to Maryland, I have a new incentive here.
I mean, I do think there are concerns about the maintenance and the further expansion of state investments in full-day kindergarten and pre-K. One of the things that we have a blog called Early Education Watch, and one of the things we do is we track developments that are happening at the state and local level with it. And one of the things we've seen that has been disturbing to us is an increase in the number of school districts that are starting to charge parents for full-day kindergarten in order to recoup revenue, and that's a concerning trend because of what we know about the kids who most benefit from full-day kindergarten. In terms of state budgets, I do think that we see a lot of the elected officials of these states trying very hard to preserve the investments they've made. Pre-K Now recently put out a report looking at this, but it is simply the case that the amount of space in the budget is limited, and with education and Medicaid account for so much, there's a limit in other things that you can cut to preserve them. 2 things in particular. One, there is a federal role in making sure that these investments are preserved. The federal role in investing in early education, as Bruce shown, has declined over time, and we need to catch up and probably further expand that to complement the work that states have been doing already. And then second, we do need to look at what we're doing in terms of efficiency as well as simply new investment. We can get efficiency gains by improving alignment between grade levels, by addressing summer learning loss that will contribute to what we're doing in ways that don't necessarily have the cost of some of these other things. And that's important not just in terms of losing these programs, but in terms of just making sure that the gains from those investments don't get lost naturally as children move into school systems that aren't always as high performing as they should be.
Correct. All right. As you ask your questions, please state your name and the organization with you. Do we have any questions for our speakers? Sir.
Hi, I'm Lee Herring with the American Sociological Association here in Washington, D.C. I have a question for Dr. Lang. I'm wondering how practical from a statistical and methodological standpoint it would be to, and this is in the interest of advocacy, it would be to link the data to CWI for 1994, for example, to the kids. Those kids will be entering the workforce in 4 to 5 years, 6 years. To link it to the nation's well-being in those 4 or 5 years. The relationships would be tenuous, I guess, because it just, it's methodologically metaphysical, I guess, to do. But is there an effort or an interest in doing that kind of thing? Showing, in other words, what would be the cost of the nation in 4 years if the CWI is at X, 15, 16, 54?
Well, that's a good question. And it's certainly not one that we've had the time and resources to address. and nor anyone else that I know of. But I think it's an important question and certainly something that should be on the agenda for future work.
Yeah, please.
One thing I think is interesting of note on that too is that there's more and more groups interested in this sort of return on investment and there was Brookings has done some work on, New America's done some work on some of the return on investment in investing in programs like Family Partnership and things like that. And the Federal Reserve was actually is also showing interest in this, which I think is very a very important thing. And they were out actually in Utah last week talking about that in programs that they've looked at, they see an 18% return on investment in some spending on early childhood programs. And so what they say about that is, if that was the case in the private sector, people would be crazy not to be making those investments. And so he said, and so therefore, what's the next thing? And he said, so his take on this is, we are crazy as a nation not to be making those investments, and particularly when you see those kinds of returns. And I think more and more work on how the returns on programs and health, and there hasn't been a lot of that work done, and more of that would be very beneficial to the field.
Mm-hmm. Great. Any other questions? Yeah, Bill.
I'm Bill O'Hare with the Kids Gone Project at the Casey Foundation. First of all, let me congratulate Ken and the Foundation for Child Development on another excellent report in this series. I really appreciate what you've done over the last several years to elevate children's issues, and frankly, for those of us who are been watching the presidential debates to see children just almost not at all, it's refreshing to open the Washington Post and see a front page story on children for a change. My question has to do with your figure 1 and kind of whether I interpret it correctly or not, but if you think of the fact that the kids who were in infancy in 1994 were in middle childhood in 2000, were adolescents 5 years later, it looks like the well-being, the increase in well-being in infancy and middle schools or middle childhood in the 1990s was not translated into increased well-being of adolescents post-2000, which suggests to me that what happened to adolescents during their adolescent years is more important than what happened to them during infancy and childhood, which is kind of counterintuitive. So am I interpreting that correctly? It would also suggest, maybe this is Bruce's point, that to reap the benefits of early investment, we need to continue investing in children throughout their childhood. So my question is kind of, is that a correct interpretation? Is that consistent with your understanding?
That's a good question, Bill. I think the latter point is critical, that we need to continue to make investments throughout these age groups. I think possibly the improvements in adolescent well-being bounced off of the low points in 92 and 93 a little bit earlier than those that we see for the early and middle childhood groups as well, and so adolescents had already improved somewhat before the 1994 base year. So just thinking off the top of my head, I think that those 2 points are important, that it does demonstrate the need for continued investment to see the improvements, but also with respect to the interpretation of these particular trends, possibly there was an earlier bounce for adolescents that we didn't pick up because we started in 94.
Mm-hmm.
I just wanted to say, with regards to those studies by the Minneapolis Fed, the investment really is not that they're measuring is not ongoing. It's very localized to preschool age kids, but then being able to follow them over the long term and looking at issues like crime rates and high school graduation rates. So although I think it is very important that we do continue investing, there have been demonstrations that there's a significant return the earlier you invest.
Yeah, Bruce.
And Bill, you know this better than I, but Jim Heckman, who's a Nobel laureate on this stuff, has shown, he does have research as well that shows, this issue around the Head Start, burnout or whatever you call it, that what he's shown is it's not true, that there is benefits throughout the lifetime, but not only that, but if you continue the investment in the middle years and the late years, you have huge benefits. And so it is true. You need to invest early, but keep doing so. And Bob Wise, with the Alliance for Education Excellence, he also has this chart that shows kind of investments on, front and back years. So we do it in college, we do it early, some early, but there's this dearth in high school, and we do need to sort of level that out and spend, invest more resources in high school years and try to deal with, and middle school years to deal with things like high school dropout rates and things like that.
Yeah, it really shows that policy matters throughout the continuum there. Further questions? Yes, please.
Susan Frost with the National Middle School Association. I am very happy to see a report that we can easily use with teachers and administrators to look at the whole child and what's happening in this age group. I'm hoping that more focus will be on whether or not the child graduates at the end of the day, and we're going to be able, I think, to have common indicators of that finally so that we can watch it. Let me ask the question, however, we have more and more reports, thankfully, on this topic of why we should do it. But we, as you pointed out, Mr. Leslie, have not made the jump of actually getting the finances at the national level. Last year we had the veto of the S-chip bill and the labor age bill, and nobody knows that in the American public, and we are not talking about it in the campaign. How can we translate all of these reports into action?
Great question.
So,
I'm happy to. We actually, it's interesting, we did a focus group on this question in Des Moines, Iowa, and with Frank Luntz, and he asked the question, what is it you care about as a federal issue? And people said the laundry list of Iraq, terrorism, the economy, and he said, how many of you are parents? And over half the room raised their hand, and he said, so you don't care about kids? And people became unglued about it, but what was very clear is there's a disconnect with people about federal policy and their kids. And so when he started talking about S-chip and things like that, people were like, oh yeah, but they don't necessarily make the link up front. So I think there needs to be an educational campaign. People do see it at the local level. People know local level, yes, we spend money on schools, but they don't necessarily see that link at the federal level. And I do think we all need to do a very concerted effort about getting this information out, Child Wellbeing Index, our budget numbers, what happened with S-chip, and really teaching the public that there is, if you care about kids, there is an important role, and there is an election coming up, and you should care about. We asked a question about in a poll, do you think that the presidential candidates are really dealing with this issue? Overwhelmingly not, and we all know that. There's no questions being asked about. The more questions about a lapel pin than there are about what's going on in schools and health care for kids. It's crazy, and so I think it's the more we can do to bug the media about really paying attention to children's issues and also really informing the public, I think we all need to do together as best as possible.
I just want to build on that point a little bit. I mean, we have seen the emergence in the last few years of some increased grassroots advocacy groups that are working on spending on kids at the federal level. Mike Pettit's group, which I can't remember the name of right now, Pre-K Now, works with some of those groups at the state level. The interesting thing to me is that those groups seem to be mostly focused on early childhood and things outside the public education system in terms of their advocacy. Now, some of that has to do with what vehicles have been moving at the moment, but when I go to their meetings, I talk to them, they don't talk a lot about the K-12 public education system. I think that's partly because of a perception that we have the groups in K-12 education, we have the teachers' unions, we have the different associations, and that they're advocating for that, but they speak to their members, they don't speak directly to parents, and there is a gap there in terms of the information that parents are getting about how federal policy impacts their kids' learning. I will make a quick plug for a resource that New America has available that could help parents get more information about how federal funding impacts their schools. We have a program called the Federal Education Budget Project where you can go on the web and see Title I funding that your school gets, IDEA, special education funding that your school gets, and how federal legislation has impacted that. And that, I think, could be a useful tool for people who want to do more advocacy directly to parents, and I'd urge people to check that out on our website.
Correct. Yeah.
If I could just throw in my 2 cents and not talk about K through 12 again, I'm sorry, but there is just an incredible tide of state health reform efforts going on right now. So if there are state level advocates and experts that can be mobilized to try to figure out how to get at the table when these commissions are meeting that are either appointed by the governors or done through the legislatures. There's a great opportunity to really impact what's going on and what might come out of the whole health reform movement these days.
And I wanted to make a point about your question. In Maryland, we work very closely with Ready at 5. It's based in Baltimore, and they do a lot of some of the PowerPoint that you saw today, the results framework came from them. They put it together for us, so we're collaborative with them. But last year they brought Art Rolnick, who is, and I won't even pretend to repeat his statistics, but he talked about the investment in early care and education, early childhood, and what that would mean to our society on the whole later on. He states that the investment early on will pay off in big dividends later on. So I think you're right, and it's bringing people like that, economists who don't normally talk about early childhood, to speak to people about the issue.
Yeah, it's interesting to see. There's an Obama ad that's not running yet, but it's on. You can YouTube it, about his philosophy that his first priority will be to do what's best for kids. I mean, first folks could have written that ad. I mean, it's the philosophy, and it'll be interesting. My point of bringing that up is it'll be interesting to see if they end up running that broadly in the general. Further questions here. I'm going to ask Ken here to start to wrap up then, as we think about it. Does he, as he's heard our speaker speak about his report, does he now reflect on any of the presentations as he thinks about any kind of policy recommendations that come out of his report, or anything he'd like to comment on from the presentations that he heard?
Well, I'm a social scientist, not a policy person, so I confess that I enjoyed all of the presentations that have suggested ways in which policy relates to these outcome indicators, and some programs that could help them even more. I would make the following comment in closing about the Child and Youth Wellbeing Index. I think one of its virtues is that it forces us to think about children in their entirety, and not to compartmentalize them as we do in governments into education, health, and delinquency, or whatever it might be. But there's a whole child here. And what the CWI does is it builds upon the body of research literature that tells us that. And it tries to piece together the indicators in a way that's informative with respect to measures of changes in overall child well-being, and not just in one or two domains of well-being. And I do think that, as I remarked at the end of my presentation, that the current period, 2007-2008, will impact negatively on our overall composite index of well-being when the data are available in 2, 3, 4 years. And I think it will not just be, as Sarah indicated correctly, through family economic well-being, but through impacts on several of the domains of well-being. And so to the extent that the CWI forces us to think about all of these aspects of children's lives, I think it makes a contribution.
Very good. I think that's a good way to end here. I'd like to thank Ken and all of our speakers, and I'd like to thank you and the Foundation for Child Development for coming and making this such a great morning. Thank you to our media, and with that we'll conclude our event. Thanks a lot.